diagnosed. I used to be very thin talaga. Thin, with regular menstruation.
Okay.
But late 2015, sometime around December or November, I was diagnosed with PCOS. That time, ang PCOS, hindi pa siya basically well-explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglyce, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw kong aparador, mukha na daw kong gasol. Aside from the hypoglyco, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So, parang binabasag talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure
Kahit
ko.
walang trigger.
Kahit walang trigger.
How did you come across SimplyNature PPARs?
Nalaman ko siya through Ma'am Jocelyn and Sir Jhen. So, they introduced PPAR to me kasi one time we were having lunch. So, very big yung appetite ko. Akong excuse si Ma'am, always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARs, first month pa lang. Actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday, nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nila, ang hirap daw, sabi ng doctors, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you can see on your screen, the result actually says ovarian is bilateral. So, both sides.
Yes, bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tapos yung right ko, reduce na yung size. So, working on it para ma-clear na siya. First of all, I wanna thank Sir Jhen and Ma'am Jocelyn. Really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila, medyo nire-refer ko na rin sila. Tapos, kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did it to you, it wouldn't be hard anymore because they see the improvement, they see the result on you as well.
Living witness na sila eh, kung ano yung nangyaring changes. Good morning, I am Monique B. Marzad, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. And then when I started using PPAR, the migraine episodes, hypogly, and my drastic gaining of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I trust SimplyNature.
Even before pregnancy, I'm already taking PPARs. My husband and I, we were really taking, I think during the time, we've been taking it consistently for 5 to 6 months already, PPARs tablets. So, I even think that helped us during the this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're just, waiting on the Lord and praying for His timing. And during the time when I got pregnant, I also realized that, oh, actually we've been taking PPARs. So, because I've read and heard that PPARs helps with cell repairs, it strengthens your body, it's high in antioxidants and all that. You know, I really think that that contributed for us to have a healthy pregnancy. And yeah, that's what I also took during that time. After I have given birth, I really had difficulty because I had emergency CS. So, but after, on the third day onwards, I was actually feeling better. After giving birth, we're gifted with PPARs, so praise God, and that has helped me a lot because they said that the hormonal changes do not just happen during pregnancy and even after pregnancy. So we started taking PPARs also. And I know mommies who have given birth, I know you can relate to this. If you have experienced constipation before birth, when you have given birth, it becomes like more. It gets to the next level of constipation. So I'm glad I was able to take, and I was introduced to Cleansing Plus of SimplyNature even before pregnancy. So when I experienced all this constipation, when I took Cleansing Plus, it has helped me with my regular bowel movements and to be able to release easier and faster. When I felt constipated, because it's true, even after you have given birth, if you're already constipated, it's like it's gonna go to the next level of constipation. I don't know how it happened, but when I read about it, it's all because of the hormonal changes that happens in our body and our body adjusting and healing. So it's going through a lot. It has helped me because especially if you have given birth, whether that's normal delivery or you had cesarean, you're not really allowed to put pressure when you're about to go. So you're not allowed to push. So the Cleansing Plus really helps, no, for you to be able to release, better and easier. What has helped me in this pregnancy journey and even before that and even after is that I was taking PPARs. My husband and I were taking PPARs tablets. So that has helped me with, of course, the hormonal imbalances. It has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no contraindication, so that could also help you. So you may try on your own and test it for yourself. Hi, I'm Nesta Vicencio, and here's my son, Ethan Kairos. So I had an amazing pregnancy journey and recovery with the help of SimplyNature PPARs. Thank you, SimplyNature. We love you.
Good morning, I'm Mrs. Melinda C. Hispano. Ako po ay na-diagnose ng stage 2B breast cancer and I'm from Muntinlupa City. I'm a public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, no, falls apart, no? Sobrang down. There is no symptoms eh. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was, magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was on the hospital, sa aking bed, browsing through the Facebook, I saw the face of Dr. Jhen. Sabi niya, makakatulong po sa mga chemo patient, yung SimplyNature PPARs. So if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised to supplement chemo with PPAR powder saka tablet. So at first I was hesitant kasi very mahal po siya. Pero first chemo ko, taking PPARs, hindi po ako nahirapan. So I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So I was telling my family na parang maganda po yung PPAR sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the Simply PPAR. Kasi po, even my co-teachers, even my family, sabi po sa akin, hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Johnson and I was able to take SimplyNature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So I just ordered 6. 6 ngayong May. So that would last for ilang months. My latest ultrasound, fixed pa din po siya. No calcification or anything. So I thank God for that. Mapapayo ko po sa mga pasyente po na katulad ko, go to the right doctor, no? You pray for the right doctor. Kasi ako pinray ko lang para bigyan kayo ng the right supplements. And para yung journey nyo, yung cancer journey nyo, will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko na I will be the most successful chemo patient in the whole wide world. Thanks, PPAR. I will highly recommend po SimplyNature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me na take ko yung PPARs. Kaya nga ang sabi ko, I will be the most successful chemo patient kasi may supplement ako galing sa SimplyNature, which is PPAR powder and PPAR tablet. So, blend together, it helps me a lot. And I'd like to thank my daughter, si Cadiz, and also my husband for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nga, nung sabi ko, a-attend kami, and he was very supportive, binatid niya ako dito. I am Melinda C. Spano. I'm a public school teacher. I was diagnosed with stage 2B breast cancer. Upon knowing my situation, it was really a very devastating event. I was advised to do 8 cycles of chemotherapy and natatakot ako dun sa chemotherapy. But with the help of SimplyNature, na-surpass ko, nakatulong po sa akin. It's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So, I'm very, very thankful to SimplyNature because it really helps me a lot. And ang feeling ko, I'm a very successful chemo patient because of SimplyNature. I trust SimplyNature.
Hi, everybody. Welcome to a program entirely dedicated to evidence-based natural wellness and the profound potential of proactive healing. I'm Sheila, your host for today. Together, we will explore the cutting-edge science behind SimplyNature PPAR supplements, a remarkable formula sourced from a highly specific, unique strain of microalgae, clinically studied for its cellular benefits. This natural powerhouse plays a vital role in supporting comprehensive cancer care, dramatically strengthening your immune system and giving you the upper hand in managing long-term chronic conditions such as diabetes, hypertension, and high cholesterol. If you are truly ready to take complete control of your health, Arm yourself with deeply informed choices and experience steady and lasting progress. You are exactly where you need to be. For many years, the standard PSA blood test has been the go-to tool for checking prostate health, offering peace of mind to millions of men and families. However, as many patients quickly find out, a single number on a lab report rarely tells a whole story, often sparkling unnecessary anxiety on leaving important questions unanswered. A high PSA doesn't always mean you have aggressive cancer, just as normal number doesn't completely guarantee a clean bill of health. Today, we are stepping past the confusion of standard lab ranges to explore how modern medicine looks at the whole picture, ensuring you get the clear and accurate answers you deserve. In this session, we will empower you, or we want to empower you with the latest knowledge so you can feel confident and in control of your own healthcare journey. We will discuss how these tools can help you and your doctor make personalized choices, whether that means safety monitoring the condition through active surveillance or choosing the right targeted treatment. Thank you for joining us today as we cut through the medical jargon and explore how to achieve the best, most personalized care for you and your loved ones. Throughout this webinar, feel free to send in your questions by dropping them in the comment section. We will be answering as many as we can during the AMA or Ask Me Anything portion at the end of the program. So don't hesitate to get engaged with us. At this point, we would like to share the perspective of a dynamic leader, successful entrepreneur, and respected international speaker in personal development and integrative healthcare. As the CEO and founding director of SimplyNature International, he brings both expertise and purpose to this conversation. Let's take a moment to hear his insights. Let's all watch Mr. Shyan Lim.
Hi everyone, today's episode is about prostate cancer beyond PSA, understanding inflammation, hormones, and cellular signaling. Well, good evening. I'm Shyan Lim, CEO of SimplyNature and PPARs expert from Singapore. When we think about prostate cancer, we usually just think about PSA levels because that's what the doctors often refer to. And that's the go-to word if you are suffering from prostate cancer. So PSA levels, surgery, radiation, these are essential, but here is the powerful truth. Cancer does not grow in isolation. It grows in an environment. It grows in your body. So two persons with identical PSA levels could be doing differently in their fight against their prostate cancer. Studies show that many men have metabolic issues like insulin resistance years before a diagnosis. This tells us that managing this condition isn't just about removing a tumor, it's about improving the terrain where the tumor exists, all right? So let me put it in a more conversational manner, all right? So managing prostate cancer, and the good news is prostate cancer is one of the slowest growing cancer, right? Managing prostate cancer starts way before you even get the prostate cancer. What you got to do is manage the environment in which prostate cancer can occur, and you are actually managing prostate cancer. And again, this is good news because since prostate cancer is a very slow growing cancer, it gives you a lot of time to change, right? The environment that is creating the prostate cancer, right? So it's like, it's very difficult to catch a mouse because they run so fast, right? But if you're supposed to catch a snail, it's so easy to catch a snail. So that's one of the good advantages about prostate cancer. Because it's slow growing, it gives you the opportunity to change the environment, which is the health of your body, and that will make a big difference in being victorious over prostate cancer. Okay, let's take a look at our details today. Inside every one of our cells are control systems called PPARs, peroxisome proliferator activator receptors. Think of them as your body's internal balance switches, your on and off switch, right? Cancer cells thrive in chaos, right? Chaos means everything's messy. They love chronic inflammation, unstable blood sugar, okay? In fact, high insulin and inflammation can act like a fuel for abnormal growth. PPARs helps to flip the switch. It's like an on-off switch. They can calm inflammatory signals and improve how the body handles fats and sugars. This is why SimplyNature's PPARs is able to help you manage your blood sugar level and also your cholesterol level. Right? Essentially, PPARs is able to shift the body from a stress-driven state to a regulated one. All right. Okay, SimplyNature PPARs itself, our PPARs, is derived from unique microalgae designed to support these natural pathways. So, what's the difference between ours and pharmaceutical? So here's the good news also, right? For those of you who are wondering, what is this PPARs thing? Is it credible? Well, yes, it is. In fact, it's an important part of pharmaceutical drugs, right? PPAR-based drugs are one of the most researched drugs in the world because it can be used to treat more than 40 chronic illnesses, including the treatment of cancer. So some popular PPAR drugs are the ones used to manage blood sugar and blood cholesterol. So yes, the mechanism is like that. Now, we always hear that drugs have side effects. Why? Because drugs are designed, right? Many drugs are derived from nature. That means they get, for example, the mechanism of action from nature, from a plant extract that they look, but then they will design a synthetic ligand, a synthetic form of this molecule. The reason is also commercial reasons, right? You cannot patent, okay? You cannot protect. Okay, for example, ampalaya. Because ampalaya is natural, it belongs to everybody. So that's why you don't see any pharmaceutical company coming up with an ampalaya-based drug, a drug made from ampalaya, because they cannot. It costs a lot of money to do FDA testing and all that, millions and millions. And if you do it, and everybody who uses ampalaya can use it, then why would you be the one to pay the millions? So there are some structural setups that makes natural products less likely to be used as, or totally not used as, a drug for treatment. However, many drugs derive their inspiration, the mechanism of action, from nature. Then they create a synthetic ligand that they can patent and protect. And don't be angry with the drug companies for that. They need to do that because it costs a lot of money to do the research and to get the clearance, right? So just a little bit of tidbit for you to understand how come there is drug-based PPARs and then there's natural PPARs. So ours are natural PPARs, okay? One of the great advantage about natural PPARs is that natural PPARs, because they are natural, they are able to be processed and absorbed by the body safely, without side effects. Now, this is not true of everything that's natural because there are also natural toxins. There are natural herbs that have toxic side effects as well. Just because it's natural does not mean it's absolutely safe. But for SimplyNature PPARs, our PPARs have been eaten as a food for more than 40 years. That's why our extracts, natural as they are safe because our product is not, our microalgae is not categorized as an herb, all right? You know, herbs like ginseng, if you eat too much ginseng, there is actually ginseng toxicity. So herbs have to be used carefully. That's why even in the Chinese culture, herbs are prescribed by traditional Chinese medicine doctors. So they have to study many years to know how to use the herbs safely as well. However, SimplyNature PPARs fall in the category of foods, so it is safe even for young children to take. It's safe for my pets. My pet dogs all grow up in PPARs. My nephew started eating PPARs when he was 2 or 3 years old, and he's turning 17 this year. So yeah, and he's non-stop. Every day he's been eating PPARs since then. And that's how safe the product is. But yet, it is so powerful for those of us who are fighting cancer. So I can see questions are coming up, right? That you want to know more. All right, how do you change your terrain, your body, so that prostate cancer can be better managed? And how can PPARs help you regulate the chaotic environment in your body, your inflammation, your blood sugars, your blood cholesterol, all this that will affect the success rate of your fight towards cancer. So keep the questions coming. I'll start answering them in the next segment, in our Ask Me Anything segment.
Hi everyone, for those of you who just came in, welcome to another episode of Simply Nature Answers, Welcome to the Ask Me Anything segment of Simply Nature Answers. For our newcomers, we are thrilled to have you with us, and we hope that Mr. Sean's discussion has sparked some great questions and help you navigate these insights. Now, it's time to bring in the panel of experts to provide the answers you need tonight. Let's get started. First off, she brings both professional expertise and genuine care to the way we serve our clients. Please welcome our resident pharmacist and one of Simply Nature's dedicated client service officers, Ms. Jhen Macanjola. And of course, I'd like to call on once again our CEO and founding director of Simply Nature International and PPARs expert from Singapore, Mr. Shyan Lim. Good evening, Sir Sean. Good evening, Ms. Jhen. I'd like to start off this evening, sir, by greeting, of course, our dads out there. Advance Happy Father's Day.
Oh yeah, it's Father's Day coming up. All right, very excited to answer your questions specifically about PPARs. So let's start the ball rolling, Sheila.
All right, okay. For our first question coming from Ms. Kiara Rosales, question is, can I take PPARs without undergoing biopsy? Ooh.
Okay, the answer is, first let me answer, why do we take biopsy, okay? So you take biopsy to decide the type of treatment that you want, right? So for example, if you have a breast cancer, you have a breast tumor, and you decide to go for chemotherapy, right? Decide to go for chemotherapy, you need to know exactly what type of breast cancer you are. You can be HER2 positive, HER2 negative, that there are many different types of breast cancers out there, right? And this is true for all types of cancer. So when you say lung cancer, there's small cell lung cancer, there's large cell lung cancer. And for each cancer type, the treatment is different. That is why you need to do a biopsy for you to decide the treatment discarte, right? So if you don't know what the cancer is, you can't choose the right drugs for it. Now, can you take Simply Nature PPARs without biopsy? The answer is, of course, yes. Why? Because we are natural. We work on your immune system, your body, your inflammation response, your immune response. So it doesn't matter what type of cancer you have, the product will still work for you. So in other words, do you really need a biopsy? If you are just choosing natural treatment, then the answer is you might not, okay? Now, why am I still saying might not? Because number one, you would want to know whether you have cancer or not. So some types of cancer can be diagnosed without a biopsy, right? Some cannot, all right? So it depends on the type of cancer that you have, right? If your cancer cannot be palpated, palpated is a big word, right? So basically, if your cancer cannot be touched, right? For example, you have a growth in your stomach. So no matter how you press your stomach, you cannot feel it. If you cannot feel it, it might be difficult for your doctor to conclude that that is a benign, which means not cancer tumor. That means it's a normal kind tumor. It's not a tumor, it's not cancer, it's just a tumor, or whether it is stomach cancer. Right? So it depends on where your growth is, if you can touch it. So for example, if you have a lump in your breast, if your doctor can touch it, plus asking you questions and seeing other symptoms, he can let you know, this growth that you have in your chest, it's cancer. Okay, so some growths can be diagnosed as cancer without a biopsy, but others cannot. But if you're going to take conventional medicine treatment, yeah, you will need to go for a biopsy, right, to find out what type of drugs to use. Now, can you use PPARs without a biopsy? The answer is yes. Would it be useful if you do a biopsy? The answer is also yes, right? If you know it's cancer, then you will be more disciplined to do many things. Diba? You will watch what you eat. You will know whether to get a liquid powder the extract powder or the extract liquid, depending on how serious your cancer is. Why would that make a difference? Because for some of us, money is an issue, right? So if it turns out that the growth is not cancer, then Maron, you might choose soft gel capsule or tablets. That means you want the growth to shrink over 6 months. It's okay because it's not cancer, diba? You get a extract powder, which is less expensive which is less costly than the liquid extract. But if it turns out that oh my God, this is actually cancer, you might decide to go for the liquid extract straight away because it's the strongest. So first answer is yes, you can take SimplyNature PPARs without a biopsy because it will work for all cancer types. Okay, it will also work to shrink your tumor if it is not cancer. So depending on what kind of tumor it is, right? It might be a myoma, it might be, yeah. So again, if it's benign, that means it's not harmful, then it's okay. Yeah, so you can. The answer is you can. Is it a good idea to take biopsy? Again, probably depending on the type of tumor that you have, and again, the type of cancer that you have. And last but not least, whether you want to treat cancer naturally or conventional. If you want to treat cancer naturally, then very likely you might not want to do biopsy. You'll go for scans instead to confirm whether it's cancer or not. Then the reason why people who opt to do natural treatment don't go for biopsy is because when you do biopsy, you always risk causing the cancer to spread, even if the risk is small. But since you're not going to use drugs, then you don't need to know what type of cancer it is, right? So you can straight away take SimplyNature PPARs and, of course, other protocols to help you fight cancer.
Couldn't agree more. Thank you, Sir Shyan. Miss Jhen, would you like to add anything?
Well, Sir Shyan has answered it very extensively.
Okay, next time I must leave more room for Jhen.
All right. So shall we go to the next question? Okay. Next question is actually interesting. Coming from Miss Jovita Villaflor. Question is, does PPAR cure PTB positive?
Okay. PTB positive means pulmonary tuberculosis, right?
Yes.
Okay, so the answer is, what's the question again? Whether we can cure, is it?
That's right. Yes.
Okay, number one, we can definitely treat the most common root cause of PTB, which is diabetes, right? Most tuberculosis patients are diabetic. So you want to know why this is the case, right? Because 30% of us, that means if you look in your family, there is a good chance someone in your family is carrying tuberculosis bacteria in their chest, all right? But you're not spreading tuberculosis, or you don't have tuberculosis because your immune system is constantly killing the tuberculosis bacteria, and you don't actually become sick. You actually don't catch tuberculosis, but you are likely a tuberculosis carrier. What happens to a diabetic patient is that diabetes causes your immune system to be weakened. So the moment your immune system weakens, you change from a carrier into a person with tuberculosis. You now are no longer a carrier, you are actually a sick patient. You're actually a tuberculosis patient. Okay, so what can SimplyNature PPARs do? Well, SimplyNature PPARs can definitely manage your blood sugar, right? So that is the cause of being PTB positive in the first place. Now, if you are a carrier and you have not actually developed full-blown tuberculosis, but you are positive for tuberculosis bacteria in your chest, take SimplyNature PPARs. Or if you do have tuberculosis, I will encourage you to take at least a soft gel, preferably the extract powder. What will it do for you? It will strengthen your immune system. It will also very quickly and very strongly manage your blood sugar and raise your immune systems. Okay, so it can do that. But my advice to you, and this is not just advice, I guess my opinion or my strong recommendation or my instruction, if you want to put it so strongly, is please go and see a doctor, because the best way to treat tuberculosis is just to take antibiotics. Okay? You don't have to do surgery, no chemotherapy, nothing so scary or harmful. It's just antibiotics. Okay? You have to, because tuberculosis is very infectious. It can spread to your family very easily, right? And if they have a cough or cold at the same time, then they're gonna catch your tuberculosis, right? And it can lead to death, if not taken care properly, right? So I'm not sure in Philippines, is it the rainy season or is it over? So that's a bad idea to not go and see a doctor. So again, don't be afraid.
For tuberculosis, the treatment is very simple. It's just antibiotics. And they might need to do some tests to know which strain of tuberculosis, right? Because there are some tuberculosis which are stronger than others, and you have to use stronger antibiotics. But don't be afraid. It's just antibiotics. It's just how strong is the antibiotics and how expensive it would be, okay? But no, nothing to be afraid of, nothing for you to hesitate. Nothing for you. Please, this is a disease. You don't have to go natural, okay? You don't have to go natural. There's no advantage to treat tuberculosis naturally. There's nothing scary about the antibiotics in the first place. Okay, but it is very important that you quickly go and see the doctor tonight, tomorrow morning. Okay, they will issue you the correct antibiotics so that you don't spread it to your family. Most likely, your family has to take the antibiotics already. Okay, because when my partner had when my partner had tuberculosis, everybody in the company had to be on the antibiotics because we are Asians, right? Meryl, we share food together, we eat together, and the chances are all of us have tuberculosis bacteria in our lungs already. Okay, so please do that.
Thank you, Sir Shyan. Ms. Jhen, would you like to add anything?
Yeah, the treatment for tuberculosis is correct. It's antibiotic and it's very accessible. I think almost every barangay in Philippines
Yeah,
have
they may give you
dots.
free, right?
Yes.
Some
Yes.
barangays is free because it's so scary. They don't want the whole barangay to have tuberculosis. So they will not only give it to you free, they will give it to your family free, if I'm not wrong. Yeah.
Okay, yeah.
Jen. Sorry, I interrupted Jen. Okay.
You're
Yeah,
on
Jen,
mute.
what's the policy in Philippines? If someone has tuberculosis, do they also like give the family members antibiotics as well?
They might need to undergo sputum test first.
Okay, yeah, because it's very infectious, So yeah.
Pero
Okay,
the
so
complete treatment for tuberculosis is up to 6 months. And then they have to take 4 pieces of the antibiotic 30 minutes before breakfast.
oh,
So
okay.
if you're also taking PPARs, you can take the PPARs 1 hour after breakfast na lang. So it will not interact with the tuberculosis antibiotic.
All right. See, this pharmacist telling you, or she even tell you how many capsules you're going to take already. All right. So again, Jen, is there anything to be worried about for, many people don't want to see the doctor because they're so scared they need to go for surgery. Like for cancer patients, they don't want chemotherapy, they don't want radiation therapy, so they don't want to see the doctor. But for tuberculosis, is there any reason for anyone to want to go natural?
Not really, sir. You're correct. For this, don't go natural.
Don't
You
go
really have to
natural.
do,
All right. Okay.
you really have to do conventional antibiotics.
Yeah, just antibiotics, okay?
Yeah.
But
It's
take
just,
PPAR
I
tablet.
think the biggest disadvantage lang is the capsules are very big. It's the biggest size of the capsule.
Okay,
In terms
okay.
of pharmaceutical sizes of the capsule, it's the biggest, and you have to take 4 of them.
Okay, it's okay
30
lah.
minutes
Just
before
chop it up with
breakfast.
a pill cutter, di ba?
Yes, and for kids naman, they also have in syrup form.
Oh yeah. Okay, so it's very important. Don't try to go natural, especially if you have kids at home, right? You don't want your kids to catch tuberculosis. It's more lethal for them. Yeah.
Thank you. Yeah, talking about kids, most of the schools in this season actually just started their school year. So best to go, not to go natural. I like the honesty, Sir Shyan and Ma'am Jen. Thank you. All right, for our next question, coming from Ms. Rosimo Colimag, question is, can PPARs help with skin sensitivity currently undergoing radiation therapy?
Oh, definitely. Okay. Okay, why? PPAR manages inflammation and immune response. So, for example, patients with eczema and psoriasis, right? It helps them manage so the skin will not be itchy. It will not have breakouts, right? So it manages the response. So that's like an antihistamine, but it's natural. Okay. Next, I really want to recommend to you our product, AD Pro. Okay, because that's going to help you. You're going for radiation therapy. So usually, if a patient goes for radiation therapy, the only thing the doctors can recommend is usually only like aloe vera, okay, to help cool the wound or moisturize the wound. All right, and maybe they might even prescribe, but I doubt that they will want to do that, which is antibiotic cream. But the problem with antibiotic cream is that it will also kill it kills the bad bacteria, but it will kill also all the good bacteria. And the good bacteria on your skin is necessary for it to heal, okay, to prevent it from being itchy and so on and so forth. So take Simply Nature PPAR tablets is good enough, all right? It will help your blood sugar, blood cholesterol at the same time. It will help with the inflammation. It will help with the sensitivity of your skin, all right? A lot of people, even our Sir Emerson. Sir Emerson is the head of our B2B. That means he's like the head of the med rep department where they talk to the doctors. He himself is actually sensitive to seafood. But after taking PPAR tablets, he can eat seafood without breaking out, right? So this is again to show you how it helps to, like an antihistamine, but help to modulate your immune response, okay? Does it stop any sensitivity immediately? Over time, yes. Immediately, like over 1 day, 2 days, the answer is no, because it's not a drug, right? So it's correcting your immune system from the inside slowly. So it'll take some time, anywhere between a week to a month, you'll see an improvement in your skin sensitivity. But the AD Pro is immediate, right? At the moment you apply on it. So you can check with Sheila. I think we might have some promotions right now in Simply Nature. If you buy certain products, you actually get the AD Pro free. So check with Sheila about that later. Yeah.
Stay tuned because we will be doing a lot of exciting announcements right after this program. Miss Jhen,
Yeah, but for any of you,
yes, sir.
sorry, just one more time. Anybody who's doing radiation therapy, the AD Pro will help promote healing for your skin. Why? Because the radiation therapy will kill every bacteria on your skin also. Okay. In today's conventional medicine, when you go to see a doctor, if the doctor gives you antibiotics, usually after you finish your antibiotics, the doctor will give you probiotics. Right? The doctor will give you why? Because it's very important to restore the bacteria, or what we call the microbiome of your gut. Now, the same thing for your skin as well. Okay, so no, I know that there are moisturizers out there with probiotics inside. These are not therapeutic level. That is like Yakult. You know, when you drink Yakult, you tell yourself it's good for your stomach, right? Good for your GI. But you know, Yakult is like, I think, what, 30 peso? But the real probiotic is like 1,000 pesos, okay, for 30 capsule. So you obviously know which one is the real thing when you are sick, right? Yakult is a tasty drink that you tell yourself that is good for you, okay? But if you really want probiotic, you get the real probiotic. So the moisturizers on the market, you know, there are a lot of moisturizers now they put on there with probiotic. It's not the same, all right? It's really not the same at all. So if you're going for radiation therapy, you want to promote the healing so that the scarring is less and everything, and not itchy and everything. Use the AD Pro on the outside, the tablets from the inside.
Excellent. Miss Jhen?
Yes, I just want to continue on what Sir Shyan was saying. AD Pro on the outside, then PPARs tablets for the inside, because our PPARs tablets is very packed with vitamins, minerals, and phytonutrients. Actually, I have a friend, she had a cervical cancer and then she underwent radiation also. But now, her cervical cancer is okay, pero she has pain in the pelvic area because of the radiation. So the radiation also affected her bones. It became brittle. Ganyan. But our PPARs tablets, I tell you guys, it has lots of nutrients talaga. So we have complete vitamin B complex, B1, B2, B12, B3, B5, B6, B7, B9. And then we also have calcium. PPARs tablets have calcium for the bone health. It also has vitamin D, so it helps absorb the calcium naman. Then we also have vitamin E. Yan. Aside from the skin, like for Myra E, it also reduces the stiffness of the bones. Yan. Then we also have magnesium. It's another anti-inflammatory. We also have zinc in the PPARs tablets for cartilage health. And I tell you, there's more. Selenium, it slows down the bone loss and supports bone building. So that's one. And lastly, omega-3 fatty acids. So they're also anti-inflammatory. It helps lubricate the joints.
No wonder
For the
it is
bones.
no wonder it is always included in the protocol of our PPARs. Definitely. And I love that it's coming from our pharmacist. All these details, a lot of information also. Thank you, Miss Jhen. Thank you, Sir Fran. Okay, for our next question coming from Miss Adrienne Aguilar. Question is, can PPARs help manage my cancer-related pain? I want to stop my pain relievers. Oh.
Okay, PPARs is not specifically a pain reliever. So you're probably taking an opiate. My grandma was actually taking morphine during the last stages of her life because of the pain, right? Now, PPAR can help with the pain by managing your inflammation, right? So one reason why a cancer patient experiences pain is because of inflammation. So PPAR can help with that, and it will reduce the pain. Now, it might result in you uh, lowering your dosage of painkillers. But if you want to just totally remove pain, PPARs is not the pain relief solution, okay? But what it does, since you have cancer, is that PPARs will help you fight cancer. So it'll help you be stronger as well. So if you are, for example, our patients who are bedridden, as fast as less than 3-4 days from bedridden, they can walk around. Of course, with a walker and Yaya's help, right? But it's a big difference between lying on the bed and being able to walk around with someone's helping. So the energy level will come back. If an energy level comes back, you will feel better as well. Obviously, the pain will be more manageable, but it really depends. So certain types of pain, for example, bone cancer pain, it's really very difficult to manage, and like opiates like morphine will be actually the best choice. Okay, but again, you take the PPARs to help you fight cancer, right? Very, very effective for helping you fight cancer, and pain relief is one of the benefits. One of the benefits.
Excellent. Thank you, Sir Sean. Miss Jen, would you like to add anything?
Oh, that is very correct. Even as Doc Johnson explained before, that aside from the tumor itself, it's enveloped by inflammation. So one of the mechanism of action when you take PPARs, and what we observe with our patients, there's an increased, rapid, decrease of the size, because it's ano pala, the inflammation pala.
Thank you, Ms. Jen. It's good that we've discussed this part because, inflammation and pain actually affects our patients' sleeping habits. And
Yeah.
I love that, some of our patients, when they share after using the PPARs, they are able to sleep well or better compared to how they were doing. And sleep is a very big chunk during their journey. So, yeah. Thank you.
Yeah. Actually, it's very interesting. A lot of people, when they take PPARs, they feel more energetic. So same for cancer patients. And there'll be some people who ask me, oh my God, if I take PPARs, will I have difficulty sleeping? So the funny thing, or very interesting thing for PPARs, is that when you're awake, PPAR keeps you energetic. And when it's time to sleep, you close your eyes, boom, you fall asleep, all right? So actually, PPARs is kind of hard to describe how it does its job, because I say if it's a sleep aid, then you think that it'll make you sleepy. But then it gives you energy. So if it gives me energy, I'm so scared that I can't sleep at night. No, it actually brings your body back to its normal. So when your body is healthy and normal, when it's time to sleep, you sleep. When it's not time to sleep, you actually feel energetic. All right? Yeah.
Yeah, I just want to mention this because one of the people, or one of the attendees of our SMX event last May 30, when we interviewed him, he specifically mentioned that after using PPARs, he felt that he always feels sleepy, even during the day. And I think that's because sleep is what
Your
he
body
needs.
needs.
Yeah,
Correct.
exactly. So there. All right. Thank you. Thank you, Sushan. Thank you, Miss Jen. Okay, another great question coming from Miss Annie. Okay. Should one really go for chemotherapy after mastectomy, or can we opt for natural method after surgery?
Okay. The choice is yours. All right. The choice is yours. If you're actually feeling very strong and healthy, it's not a bad idea to go for chemotherapy. So first of all, I would like to confirm with you or try to share with you why your onco or your surgeon will recommend chemotherapy. Okay, because they are afraid, or it's so common that even after surgery, there's actually little small pieces of the cancer in your blood, and it's circulating in your body. That is how cancer metastasizes, okay? Metastasis means that the cancer has spread. How does your cancer spread? It spreads by breaking off, like Maron dandruff, your hair dandruff, like a bit of dandruff, and it goes into your bloodstream. It travels in your blood vessels to another part of the body. So that's why it's very common for cancer to spread to places where blood go for processing. Like for example, your lungs, your kidneys, your liver. This is where this is where your blood flows, right? To this is like the collection exchange center, like the interchange, Meron, jeepney interchange, bus interchange. So it's very common for cancer to spread to those places, right? Why? Because it goes into the bloodstream. Now, after your surgery, the doctor is just trying to be extra safe, right? That they are worried that there is small pieces of cancer floating around in your bloodstream, which is why they ask you to do the chemotherapy. The chemotherapy is just going to Meron. It's like, honestly, yes, it is putting poison into your blood, right? To try and kill any small cancer cells left. Because after all, you did the surgery already. You don't want 1 year later to find out that Meron, your liver has the breast cancer cells spread to your liver, for example. Then you'll be so sad, right? After you celebrate 1 year cancer-free, suddenly the cancer come back. Then you say, why did the cancer come back? Why did the cancer come back? I thought we did the surgery and everything is clear. Everything is clear means that they cannot detect the cancer with the scans. But the scan cannot detect anything that is very small. It can only detect something, I think, 2 mm and above. Anything smaller than that, the scanners cannot detect it, which is why your doctor is thinking of injecting chemotherapy into your system to kill any cancer cells left over. Okay, so this is why your doctor recommends the chemotherapy. So you think about that. Sounds like a great idea, right? Anyway, you already did the surgery. So what can you do if you want to do the chemotherapy? You can take SimplyNature PPAR liquid, powder, or soft gel, okay, to protect yourself from any side effects of the chemotherapy. Now, usually the number of chemotherapy you to do for this preventive, just in case flushing out of cancer cells, is usually just 1 or 2 cycles only. You don't need to do a lot because they're just trying to get rid of the small cancer cells. It's not like really chemotherapy to shrink a cancer tumor. So it's not going to be super strong or anything, right? So taking SimplyNature PPAR liquids might be a good investment to protect your healthy cells so that you won't feel weak. And again, you don't want your immune system to go down because during this time, you want your immune system to be also cleaning up to make sure that your immune system kills the small floating cancer cells in your bloodstreams. Okay, can you go completely natural? Yes, you can. All right, is it advisable? Hard to tell. Hard to tell. Okay, if you're feeling strong, I would actually recommend doing both, which means go for the chemotherapy and take SimplyNature PPAR liquid which will also help to kill the cancer cells, but also protect you from the chemotherapy. Right. If you want to go natural, then I would suggest the liquid for a month and then the PPAR powder for another 3 more months to 6 months. All right. So why? Because during this time, you really have to make sure your body's immune system is top notch at its peak. Why? Just like the chemotherapy, right? You might have cancer cells floating around in your bloodstream. So during this time, you want your immune system to be as strong as possible to kill these small floating cancer cells. Okay, so the option is yours. But if you are feeling strong and healthy, that means you probably can take 1 or 2 sessions or even maybe 3 sessions. Usually, I think it's 2 sessions, they're done. I think you can take that, but don't just do the chemotherapy because you don't want the chemotherapy to weaken your own immune system, right? Because you need your immune system to fight cancer. So that's another reason why people who go for chemotherapy, who successfully fight cancer, how come the cancer come back? Why? Because after the chemotherapy, your immune system is so weak, the cancer can come back. If you didn't kill all of them, as long as 2 or 1 survive, you give it a year, it'll come back again. So this is the reason why you want to make sure you preserve or protect your immune system when you're undergoing treatment. All right. So this is when you take SimplyNature PPAR liquid and powder extracts. Yeah.
Thank you.
Sheila?
Thank you, Sir Shyan. Miss Jen, would you like to add anything?
Oh. We have successful patients who underwent surgery but
Mm.
didn't proceed to chemo.
Okay.
So yeah, like Tita Min, diba? She had endometrial cancer and then she tried all the products from liquid to powder and capsule. Ganyan. We can send the YouTube link if you want. So just chat or comment yan. Then aside from that, we also have Miss Vern. She had stage 3 colon cancer. And after surgery, she just took PPARs capsule under Doc Johan Mañez.
Because Dr.
Right.
Johan is lifestyle medicine, totally just using foods and natural foods. Yeah, correct.
However, if you decide to, after your surgery, you will proceed with chemo, we also have successful patients who under, diba? So, like Ma'am Sheila San, Dominic, she
Yeah.
needed chemo and then and then it really reduced the side effects. I have lots of patients currently asking right now, does it help prevent hair loss, especially for female?
Yeah, it helps prevent hair loss, right? But it's not 100%.
It
Some
may.
patients still lose some of their hair, but then it grows back very quickly. It grows back very quickly.
Yeah.
So therefore, either way, PPARs is there for you.
Okay, just so that everybody knows, right? We for SimplyNature, we have conventional oncologists who use our products. They will definitely recommend the chemotherapy. We have integrative doctors. They will recommend case by case. For some cases, they say go for the chemotherapy. For some cases, they say no. Then we have naturopathic doctors that are also using our products. Then for them, of course, they are very pro-natural. So in every category, we have success stories, right? And it works. We understand how it works, all right? We understand how it works. So yes, the answer is yeah, you can definitely use SimplyNature PPARs to strengthen your immune system after a surgery.
Thank you. It actually also answered the question of Miss Lolita, whose question is, I have undergone surgery last October 22. I have colon cancer stage 3. My surgeon advised me to go for chemotherapy. So just like that, surgery, and then right after that, chemotherapy. So it's actually a very common question, and it's good that we have discussed this because they tend to halt on that journey, wherein, according to Doc Jansen as well, there is this sayang factor that you have undergone the biopsy, you've undergone the surgery, you might want to go and
All the
finish
way.
all the way.
Finish it.
Yeah. So to prevent recurrence and relapse also.
Okay, one important tip or rule, okay, for those who choose totally natural, all right? Because I know some of you may have a good reason. For example, your age, or you're very sensitive to drugs, right? So it's difficult. You don't want to go to take drugs if you can avoid it. One very important thing, you have to go for your scans. Cannot miss your scan. All right? Why? Because if you're going all natural, then you have to be very watchful, right? If you're only taking chemotherapy, you also have to go for your scans, okay? But when you take both, right, then you really should be in good position. But again, the scans are still important. But especially for the natural one, because I know what happens. Those who choose natural want to choose natural completely. It's like you never ever want to go back to the hospital, okay? I understand where you're coming from. But if you're going natural, I want to say one thing. At the very minimum, you have to go for your scans every 3 months to make sure everything is clear, right? Because you are choosing natural doesn't mean that you don't monitor. Those who are choosing conventional, your uncle will make you do your scan every 3 months anyway. But for those who are going natural, please do not avoid doing the scan, okay? Don't avoid doing the scan. You can go on natural, that means just eat PPARs and other protocols, but still go for the scan. Now, if something grows again, then at least you know very quickly. Then you can either up your natural dosage or add other protocols to it, maybe other natural protocols to it specifically for whatever condition, or go for surgery again if it's possible. All right. So don't skip the scans.
Exactly. Thank you. Thank you, Sir Sean. Thank you, Miss Jen. Okay, another interesting question coming from Mr. Boyet. Question is, can AD Pro help with bed sores? This is for patients who are bedridden.
Absolutely, it's one of the best products for bed sores. All right, because what happens is that those with bed sores, right? Okay, anytime you have a sore, it becomes red, right? And it breaks, the skin can break as well. So what happens? Why is it red? Because there's a type of bacteria called Staphylococcus. Okay, this is the bacteria that causes the infection, the inflammation, the redness. The AD Pro will actually help to to push that bacteria out. Okay, to push that bacteria out. So yeah, it is the best thing for that. Okay, now since that we are talking about this, okay, let me show you. Let me show you. Okay, all right. Let me see. Where is my share screen? Can I share screen? Yeah. Okay, that's great.
Yes.
Okay. Okay, this is this is the diaper rash. Okay, this is not bed sore, but this is the diaper rash. I just want to share with you. Okay, for a bed sore and diaper rash, one thing they have in common is the bacteria, the type of bacteria that causes this. Right? You will notice. You see, after 5 days, you see how much the redness go away, and then it really dries up. It dries up. All right. So this is AD Pro. Okay, this is AD Pro. Look. All right. So I just want to share with you what happens when you have a bed sore. Okay, the virus or Staphylococcus is the bright purple one. The bright purple one, right? So when your whole body, when your body part, the skin becomes all red with like a rash, right? The sores are developing. More on your skin, everything is that purple virus. Purple bacteria, Staphylococcus. So what happens when you take AD Pro, right? You will cause the purple color bacteria. It's not purple in color. I'm just saying the one that is shaded purple here. It will start to subside. When it subsides, right, your redness will go away, right? And this will allow the bed sore to heal. It will allow the bed sore to heal. The problem is for patients who are usually bedridden, they're sleeping, that's why they end up with bed sores. It's hard to heal. Why? They don't dry, the skin doesn't dry up properly. If they put antibiotic cream, it kills everything, then the thing cannot heal again because they're still lying on it. So yeah, AD Pro works wonders.
Thank you, Sir Sean. Miss Jen?
Like the question before, so AD Pro on the outside and PPARs tablets still on the inside.
Yeah, you need nutrition to promote healing.
Oh,
Yeah,
yes.
you're right. Absolutely.
Especially if you're also diabetic.
That is true. That will make the healing of the bed sores even more difficult, right? Yeah, yeah. Surprisingly, patients who are bedridden can become diabetic because their muscles atrophy, and you need your muscles to actually burn sugar as well. So surprisingly, sometimes that can be the case. Yeah.
Thank you. I like this question because I'm also exposed with people who have kids who have special conditions like cerebral palsy. So AD Pro would be also good for their kids as well. Thank you. Thank you. Thank you, Sir Sean. Thank you, Miss Jen. I guess this will be our last question for tonight. Coming from Miss Mimi Soriano. Question is, last March only, my husband was diagnosed with rectal adenocarcinoma. He is on amlodipine 5 milligrams. His creatinine is normal. What is your best recommendation for?
Okay, when it comes to any cancer patient, we will definitely recommend liquid PPARs. All right, and then speak to the CSO, either Jhen or Ciela or Daisy. Right, our CSO are very experienced. They are licensed pharmacists. Ciela herself, her own son is a cancer survivor. Right, he was only 4 years old, and he went through like 30 over sessions of radiation and chemotherapy. Right, so they are very in good position to assist you with the dosage, okay, what to take. But we will always recommend the strongest first. Why? Because you want to get your body fighting the cancer as soon as possible. So yeah, I will recommend the liquid PPARs always with tablets. Why? The liquid PPAR is like the key that switches on all your immune system. Now, one of the common things when a cancer patient fights cancer is the lack of nutrition, right? So in Philippines, also, I notice we don't really eat healthy foods. Okay? The only vegetable dish that most Filipino eat is panabet. But is that is that correct?
Yeah, pinakbet or pakbet.
Peanut bag. Okay, that is like not a vegetable dish lang. That's like a root crop dish. Okay, you don't have green vegetables. Actually, the only place I find green vegetables in Philippines is Chinese restaurant lah. All right, the pek chai and bak choy. So honestly, the Filipino diet is really missing a lot of nutrition. So you really need a plant-based whole food, which is what the tablets are. Okay, and they work perfectly with the liquid extract or the powder extract. Okay, so immediately after this, drop a note, chat with one of our CSO, very qualified CSOs. They will go into detail what will be best for you. But yeah, I would definitely go for the liquid extract.
Thank you, Sir Shyan. Miss Jhen?
For our viewers, amlodipine is not treatment for rectal adenocarcinoma po Do not self-medicate For this
Yeah.
question.
Okay, the
amlodipine-
pharmacist is talking. I didn't talk about the drug because that's her area of expertise.
Ay. Okay, so amlodipine is for hypertension po. So the
Oh my
patient
God. Okay, so
Oo.
to the viewer, you're not even taking any medication for your cancer.
For
So
that.
please, right, start with the liquid extracts and yeah.
Yeah, so the wife commenter lang is saying that the husband has rectal cancer and he is also hypertensive na taking amlodipine 5 milligrams. And good news, PPARs can solve both. Yun. So aside from the cancer, it can also help with your metabolic. Aside from the hypertension, it can also prevent even the comorbidity, which is high cholesterol and high blood sugar.
That's very encouraging. Thank you, Sir Sean. Thank you, Miss Jhen. Okay. Well, it looks like we've covered all our questions tonight. But don't worry, for those of you who were just shy to ask your questions on the comment section, you can still throw your questions individually and privately. We'll answer those individually as well. So today's topic hit home for many. Just before we say goodbye to everybody, and of course, our advance happy Father's Day to everyone, I'd like to ask for very quick parting words, starting off, I guess, with Sir Sean and then followed by Miss Jhen.
Yeah, thank you for all your questions. This program is specifically for all the viewers who want to know more about PPARs. So today, I just want to close by, SimplyNature PPARs has been so successfully used by so many cancer patients over the last 10 years. So our most amazing patients are like, for example, brain tumors, cancer, malignant tumors, but actually within a month, everything actually shrank and disappeared, right? We also had another patient who was pregnant, right, and had cancer. So she couldn't go for the chemotherapy because that would actually cause problems with her pregnancy. So she was able to use SimplyNature liquid PPARs to fight the cancer and successfully give birth. And today she's a healthy mother of 2, if I remember correctly. So we also have cases where the one that really struck me the most is, even in the less ideal case, it's a victory. So one that really touches my heart is Dr. Angie Domondo. She had a patient who had cancer that actually spread to the brain, right? And the patient spent 6 million pesos. And at the end of the day, the cancer, they couldn't beat the cancer, right? And what was very challenging is that during the treatment, during the chemotherapy, the patient didn't do anything to protect their own immune system, their own body, right? So the patient was very weak, bedridden, almost comatose, always sleeping. So Dr. Angie actually used the liquid PPARs on her, and within one box, which is less than 10 days, the patient who was always sleeping the whole day suddenly was able to stay awake like normal, sit up on her bed. And this was a wonderful thing because her sister, the same sister that was working in UK, England, flew all the way back. This is the sister that was working as a nurse in England that actually paid for the 6 million peso worth of treatment. All right. And she was able to spend 1 week with the patient, and the patient was alert, awake, talking to the sister as if nothing is wrong. 2 weeks after, the patient slept and then very peacefully returned to the Lord, right? So both the sister and Dr. Angie were very happy. They just say sayang, they didn't find Simply Nature earlier. Because if they found Simply Nature earlier, if the patient took the Simply Nature together with the chemo treatment, then things might have been really different, right? So this is to share with you that our success stories are there. We have patients who are successfully beaten cancer with our protocol as one of their main strategies. Okay, it's the main product they're taking to fight cancer. And then we also have a lot of successful patients who managed to get what they want. They wanted to buy time and wanted to go full strong. These are especially for older patients as well, right? So in all cases, we're here from start to healing. So you've come to the right place. The product can definitely help your condition if you're fighting cancer. So I'll hand the time back to Jhen and Ciela.
So we're here for you as client service officers. Don't feel shy. Yeah, please feel free to chat us or comment below. Yeah, we'll reach out to you shortly and see you tomorrow, guys.
Crisp and quick. Thank you. Thank you, Sir Sean. Thank you, Miss Jhen. Okay, for answering our questions of our viewers tonight with care and love. Thank you. So keep informed and explore all available options. So don't forget to like our Facebook page, Simply Nature International, and subscribe to our YouTube channel. This is also to make sure that you get updated with our latest promos and exciting online and on-site events. Now, just to let you know, exclusive only for website orders only, yes, you can still buy or purchase our PPARs liquid extract or PPARs powder extract with no shipping fees. So whether you are ordering from Metro Manila or anywhere nationwide, you can avail this free shipping promo. Now, before we say goodnight, we just want to inform you that if you actually buy the PPARs liquid extract or the PPARs powder extract, you can automatically get free AD Pro serum. This is what Sir Sean was mentioning earlier, because with this promo, you are being given both internal cellular support and external skin nourishment in one powerful promo. So yes, it means that if you buy your PPARs extracts, liquid or powder via website, not only that you are getting the free AD Pro serum for free, but you are also availing the free shipping promo. Wow, back-to-back promo po ito. No? So, all right. So another one exciting promo is that if you've been dealing with stubborn eczema or psoriasis, acne, or even recurring skin irritation, it's time to level up your skin game. Stop patching the problem, fix the environment, because here is our AD Probiotic Serum, designed to support your skin barrier and help rebalance stressed out skin. But here's the best part, because if you buy the AD Pro, you can actually get one extra for free. So the promo is still ongoing. Please get in touch with your client service officers, because this is available via Shopee, Lazmall website, and via direct here in our BGC office. All right, now this Father's Day, this coming Sunday, all right, give the hero of your home the ultimate gift of pure health. From June, it's actually starting today, from today up to the 23rd of June, when you show your love by purchasing the premium Simply Nature PPARs Extra Top Gel Capsule, the Tri-Pack, or the Stay Slim package, we will throw in 5 sachets of Cleansing Plus absolutely for free. So that's actually worth 800 pesos, guys, for free. So give your dad the cellular boost he deserves by heading over to our website and using the promo code SimplyDad to unlock your freebies, plus a bonus of 50 pesos in-store credit. Or simply drop us a direct message to order right now. Don't wait, click the link on our bio today to secure this health package and celebrate a happier, healthier dad. There you go. And of course, last but not the least, we're expanding our hours to better serve you. Elevator weekend with the dedicated session of health and healing at our Saturday Dose of Wellness. This coming Saturday from 10 a.m. to 4 p.m., we invite you here in our BGC office, 15th floor, Capitol Building, for an exclusive opportunity to receive wellness advice directly from our resident pharmacist, Ms. Jhen. So whether you're looking to boost your immunity, understand cellular nutrition through PPARs, this is your chance to get professional guidance on a pharmacist's choice of Simply Nature PPARs products. So, but wait, there's more, because if you buy our flagship products, liquid, PPARs liquid or PPARs powder, here in our office, if you visit here and pick up your order here, you can get free Simply Nature umbrella. So be sure to reach out to your client service officers once again. So we hope to see you tomorrow. That's a Thursday, June 18 at 7:30 for our regular Simply Healed webinar. Do invite your friends, loved ones, and fellow patients in your hospitals to learn through our webinar. Thank you once again to all of you. We'll see you tomorrow. And remember, your victories in your fight for better health inspires us every day. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night and God bless you all. See you tomorrow.